Let's say you have a hemorrhoid surgery procedure coming up and the appointment is coming up real soon. And so you're thinking to yourself, I know they're going to do a hemorrhoid surgery of some kind with some technology, but is there anything else that's being done in the operating room? Maybe perchance something's gonna help me with my recovery? Is it just a cut and snip type of thing, being bada boom, or am I being helped somehow, or is there strategies being used even while I'm asleep to help me with the days ahead in my recovery? And I want to lift some of the veil of secrecy that happens in the operating room and let you in on what I do for my patients to help all my patients with their recovery and make it smoother. So let's get to that now. Hi there, I'm Dr. Chung and I'm a board certified colon and rectal surgeon and I'm your friendly proctologist. Thank you so much for being here and watching these videos. I am really overwhelmed by the feedback that you guys are learning something, which is the whole point. You guys are seeing that I am trying to help you by giving you useful information. And so I know the entertainment value pretty low, but I hope that you are getting better and using the information for your benefit. Today I want to dispel the myths and take off that secrecy that's going on when you talk about the operating room, because I want to talk to you about my strategies that I use for my patients to control their pain even before you go home after the surgery. I think that the plan needs to be very comprehensive, and you better believe that this plan is changing all the time as I evolve and as I learn and as I gain more experience. You know, I don't have that many gray hairs yet, but as I gain and accumulate the gray ones, I will keep changing the plan because I want to make myself better, want to keep delivering the best experience possible. So let's talk about two parts here. There's the medication side of things in the operating room, and of course there's the technique side. Like, what am I doing with my hands in order to help you with your experience? Then you can take this information, go compare it with your experience. Talk to your surgeons about it. You know, I don't think that there's really anything different about shopping for a surgeon than it is like shopping for a refrigerator, okay? What am I getting for the price that I'm paying? What are you doing? What are your functions? You know, it's no different. I want you to be educated, and I want you to use that to your advantage and defend yourself. Ask good questions. Find that surgeon or provider that's going to be the right one for you. Okay, let's talk about medications. Number one, injection. There are 3 injections, okay? Number 1, it's a local anesthetic. This is very standard across all surgeons, okay? It's the same kind of medication, or very similar to what you get in a dentist's office, you know, to numb your mouth up before you get a tooth pulled, or you get a skin tag on your skin taken off. Medication is very good at controlling pain. Usually patients have 0 pain when they wake up. However, the bad part is it only lasts 6 to 8 hours. So once the medication wears off, the pain goes way back up to 10 out of 10, as if it wasn't even there. When you're talking about hemorrhoids, you can't help but talk about creams. And the thing about creams is that there's 50 million of them out there. So how do you know which one to use? Well, you can try them all or try your friend's creams, but I think the one that will top the list will be Pranicura. And these guys have been a lifesaver for so many people, including myself. When I get the hemorrhoid bouts, I get the itch monster, okay? It starts scratching and starts like breathing on the outside of my butt. This stuff brings a cool burn or a cool soothing sensation that I really like, because that's what helps me to get on with my day. I have to only put it twice a day. I don't really need to reapply it many times, but you certainly can. I just put a little bit on the outside, just slap my cheeks together, pull out my underwear, and I am out the door. I mean, that's all I need to do. So there really isn't a huge process with this. Their ingredients are all natural. You got some glycerin, kaolin, calamine, and menthol, and it's just amazing how much this has helped. I highly suggest you go to their website, check out the reviews, because this is the only place you can get it is on their website, www.pranicura.com. Write that down, remember it, check out their website, and I hope that this helps you in your journey to recovery. Thank you so much, Pranicura. Number 2 medication is another injection called Exparel. I've mentioned this medication in videos in the past, but this medication is brilliant, okay? It lasts 2 to 3 days. That's a huge advantage. When you talk about recovery that can, the first worst part last 10 to 14 days, having some injection in there to just keep working for you, even though you're not doing anything, is wonderful, okay? And I inject this medication the same as a local anesthetic deep into your pelvic tissues. I'm hitting the pudendal nerves, the nerves that are coming out of your spinal cord that are giving sensation to your anus. I want to hit all those areas to numb them up. And then, of course, I want to get the wounds that I created from the surgery to numb those up as well. Number 3 medication is yet another injection, and that is called Botox. That's correct. You heard me right. I'm not just doing this for anal fissures or anal spasm, but I am doing it for hemorrhoid surgery. Botox is a medication that paralyzes muscle. It shuts them down. And I am injecting this into the anal sphincter muscles and also into your pelvic floor. I told you before that the protocol, the procedure for Botox injection is not standardized at all. There are many different techniques being used, and the amount of Botox is also very variable. No one seems to know exactly how much people need, but I tell you, I use a lot of Botox. I use on average at least 2 to 3 times the average surgeon's amount. And yeah, you may be thinking I'm crazy for doing that, but here is the logic behind it. After the hemorrhoid surgery, the anus muscles want to squeeze the hell out of themselves. It's natural. They are in a ton of pain. All they know how to do is squeeze. So that's the problem, is that it makes things difficult. Why? Because it is now squeezing on the wounds I just created, increasing your pain. It also squeezes when you want to go poop, so you have to push harder to get the poop out. When your hemorrhoids are swollen, the anus also squeezes and makes those hemorrhoids on the outside puff up, because now the blood that's in those hemorrhoids on the outside cannot return back into the body. It causes a lot of grief, including anal spasms or anal pain. And so Botox has been extremely helpful, and the difference is amazing with this medication. Of course, you always have to mention the side effects of Botox. There's a lot of great things that can come with it, but also can maybe create a bad side effect in your specific situation. The side effect being fecal incontinence, meaning gas or stool leaks out without your knowledge. So it does take a good conversation with your surgeon. It does take a surgeon's judgment to figure out exactly how much Botox to use for you and to screen you, meaning, do you have symptoms of spasm or muscle injury going into the surgery, right? Because if you do, you might need a little bit more Botox versus someone that has absolutely no symptoms. Now let's talk about the surgical technique. What am I doing with my hands and my eyes to help you? And the first thing is I am doing all my hemorrhoid surgeries with the combination of cutting and stitching, the traditional kind, and also with laser, okay, or laser hemorrhoidoplasty, LHP. And what I'm doing is I am directing or applying the right tool for the job. Larger hemorrhoids need a cutting and stitching technique. If I tried the laser for it, the laser is simply not powerful enough to shrink that huge mountain down. It will shrink it down a little bit, but if you do that for larger grade 3s or grade 4 hemorrhoids, the studies already show that 20% of patients will have recurrence of prolapse in 1 year. And if that is not a failure to you, okay, fine, no problem. You really wanted the easier recovery. But if that is a problem where it's sticking out again, and before the surgery it was sticking out then too, guess what you need to correct that problem? Another surgery. So you just had one last year and then you're going to have one again? To me, if that doesn't make sense to me. If you're going to have a surgery go through recovery, you better get the job done right, gosh darn it, right? So the cutting and stitching to cut that mountain down and level it out, in my opinion, is the best job. Now, what about the smaller guys or medium-sized guys? Well, that's where the laser is perfect. I can do minimal damage. I can make a small cut and put the laser fiber in. The recovery from that is much, much easier. And to cut and stitch all those little guys and increase your pain toll, right? That it's adding up. That doesn't make any sense to do that. So I'm going to spare you, do some compassionate surgery to allow you to do the appropriate job, make sure the hemorrhoid problem is solved, but also give you the benefit of the easier recovery. Now, there's something to be said about the cutting and stitching procedure because I don't believe that everybody does it the same. The purpose of the stitching is, number one, to control bleeding. When you cut through hemorrhoids, you're cutting through water or blood pipelines, and the blood just starts flowing immediately, okay? And so when you're putting those stitches in, though, is there a way you can make it much less painful? And in my opinion, there is. I will not just take my needle, okay, when I'm stitching and just whomp right through the anal muscle. The anal sphincter muscles live directly underneath your hemorrhoids, and you need to grab a little bit of muscle tissue to get things to cinch down and get it to have the appropriate technique. But there are some surgeons that will just ram that needle all the way through and deep into your muscles. And oh my God, that hurts like crazy, okay? Because when you're stitching through, you're also tightening down that stitch. You're like cinching it down. And you can imagine the anal spasm, the irritation coming from your anus when you're torturing them like that. It's just not cool. So that's what I do, is take a minimal amount of muscle, just enough so that I can get the bleeding to stop and everything to look good. And again, compassionate surgery is the word of the day. And here's another factor to consider, is that the anesthesiologist is also playing a big role. They are giving you pain medication. They are controlling the depth of your sleep. And when you have a really good anesthesiologist who can also control your nausea, vomiting, who can also give suggestions to the surgeon about what additional medications to give you while you're asleep and for your recovery, that's what makes this whole thing comprehensive. You don't want patients waking up. You don't want patients remembering anything. You want patients to get timely pain medications through your IV. All those things are very important in conjunction with what I'm doing as a surgeon. So I hope this video brings to light on the scary, dark corners of the operating room and this experience of a hemorrhoid surgery. You know, I think that the things that you're learning here, definitely go to your surgeon. Take your questions with you. Start a discussion, not an argument, a discussion about what your surgeon may do for you, or is there any feedback that you can give, and make sure that you defend yourself. If you want something done in your surgery, make it known in a nice way. And right, you want it to be a discussion. You want to be a team player. Surgery is very much a team sport. Like I said, you have the anesthesiologist, you have scrub techs, you have circulators in the room. You also have the front desk, the greeting crew. In that whole experience is very, very important to relieve anxieties, produce a positive aura around this experience. Thus, there is hope. You're about to go through something difficult, including the recovery. But yes, you're doing this for a reason, to get better. Get your life back on track. And now with the veil lifted from your eyes, oh gosh, it sounds like a baptism or something like that. But I want to close this video with, of course, talk about Pranicura one more time. Definitely write down the web address, www.pranicura.com. Check out the reviews. Do your research on this, guys. Check out the comments. I do have some videos. Take the 30-day Pranicura challenge. See if this can be a solution for you. It's helped so many people. I hope that this could bring a solution to give you some peace in your life back. Thank you so much. I hope you have a good one. Bye-bye.